Welcome students to Nursing 5135. It's Dr. Becker. I'm going to record this today so that when we do meet live here shortly, that you guys will have a little bit more time to ask some questions that are more pertinent, but I wanted to get some of this stuff out of the way that you can listen to at your leisure. This is going to be our introduction to the course. What I'd like to do first is just to start out with going through the syllabus and talking through a couple of those technical things about the course so that we can just get this out of the way. So this is Nursing 5135 for the spring of 2025, Advanced Health Assessment. This is your third and final P course. You've done pathophysiology, pharmacology, and now physical exam. And once you're done with this semester, then you'll be fully ready to launch into your decision making clinicals with PAM, which is really when you get to the grit of the course and really get out there with some clinical experience. So going through here, this is your syllabi that is posted on Canvas. Just to touch again, I know you guys know this from previous semester. This is my email and my cell phone number. Please feel free at any time to reach out to me with questions or concerns. For emails, I do ask for 24 hours to respond, or at least over the weekend till the next business day. Email is the easiest way really to get a hold of me because I do try to check my email frequently throughout the day and evening. But of course, you can always shoot me an email or, shoot me a text message and say, hey, I've just emailed you a question if you have time to get back to me. And I'll do my best because I want to be available for you and answer questions timely if or when you have them. Of course, this is an asynchronous course that's going to be on the Canvas platform. There's a course calendar that is attached on Canvas as well. It's a 4-credit course, so that means we have 2 credits of theory or didactic classroom work, and then we have 2 credits of clinical. You can read through at your leisure the outcomes and the competencies that we're covering in this course. A couple things, your required resources. We are using Rhodes and Peterson Advanced Health Assessment Diagnostic Reasoning 5th edition. It was just published recently. It is a really nice book and platform to use. Hopefully you've been able to secure either the ebook or a physical book. Either one will work, but you do need to purchase the Premier Access because that's the way you're going to be able to log on to our online platform to complete the quiz or assignments and videos. And then, of course, Pam has already spoken to you guys about needing Typhon, and I'm not going to go into that right now. These are the things you would need for your course available to go to clinical with. This is kind of our brief course plan, but we'll go over the course calendar more closely. All right, what everybody wants to know, summary of grading. So we have quizzes, exams, and then you have clinical goals. We're going to do a holistic health history with a genogram, your case studies with SOAP notes, and then one big case study with a complete H&P, and then your Typhon clinical logs being complete and accurate. So they're weighted. The biggest weight is going to be your big case study with your complete history and physical, also your case studies with your SOAP notes that are done throughout the semester as well. And then your goals, or your quizzes and your exams are worth 15%. And you can see that here. So everything is weighted. Again, this is the same as many other courses, is that to successfully complete this course, you must achieve all of the following. You have to have at least an 80%, and we do not round up. So if you have a 79.8, that would not be considered a passing grade. You have to have 80% or greater. You have to have a total of 120 clinical hours with a minimum of 120 patients seen, and all the patients have to be 13 and older. All patients have to be logged in Typhon. All time logs have to be done, and you have to have all of your evaluations done in order to successfully pass the class. My late policy for this course is that anything that's assignments that are submitted past the due date without prior approval or discussion with me will have 10% per day deducted from the assignment grade. All assignments must be submitted as Word documents or PDF files. Any assignment submitted in a different format will need to be reformatted and could be subject to any late penalties. Really, I've said this before in my courses, but the key to to succeed probably in my course in terms of anything that's happening. If you get overwhelmed, you get behind, what have you, you get sick, is communication with me. Being a key to success for any graduate level course is also going to be communication with your faculty. So if something comes up and you get the flu and it puts you under for 4 days, you shoot me an email and say, hey, I'm so sick with the flu right now. I think I'm going to need some time, but can I email you later this week when I'm feeling better? I'm so sick right now. That's perfect. You know, you are adult learners. Life is going to happen. Children get sick. You have to end up in the hospital unexpectedly in the middle of a semester. The key to that is just communication with me, and we will work together and we'll get you through. What is not acceptable is not being able to keep up with your coursework and continually expecting to get extended grace periods. That's not going to work. You know, things that are unpredictable, unexpected that may happen to you, let's work together, we'll get you through. But the predictable things, like you have a quiz every week, you have this every week, and if you're just falling behind because you can't manage your time, those are not acceptable reasons to ask for excuses. But you know what I mean by that. If true life unexpected happens, you just come to me and we'll figure it out. Again, then all of this information that you're going to find in your syllabus is the technicalities of things we've already discussed about with Pam, how you work as when you're on site. So I do want you to read through that because these are expectations of you in the clinical environment as well, and how you perform and how you present yourself are all listed in here, things that are considered the rules and guidelines to going out into the clinical setting. Please remember that we have an honor code, and essentially by starting this semester with me and starting this class, you are saying and you've signed, on my honor, I pledge that I have upheld the honor code and that the work I have done on this assignment has been honest, and that the work of others in this class has, to the best of my knowledge, been honest as well. But this is when I say on quizzes and on tests the honor code applies. This is what I'm referring to. Again, we as a school do not expect people to find proctors and to do a bunch of proctoring things because it's difficult, it's complicated, it makes everything harder. But that comes on the premise that we have students at Augie that honor the honor code. And so I always say, you know, if you are going to break that honor code, then it ruins it for everybody else. And you're not doing yourself any favors either to cheat, you know, your way through, because these are you know, cheating yourself of the information and learning it the best that you can. So please always respect the honor code, and that is in here. Please remember your health and well-being is very important, and so you do have access to things on campus, even if you're not here in Sioux Falls, and your well-being is very important to us as faculties as well. If anxiety, you know, if you're just killing yourself trying to get through this program, if you're feeling whatever you're feeling and you need to communicate with us, that's what we want as faculty, to work with you and figure it out. Life happens, right? Stressors happen, pregnancies happen, we lose a loved one, we get sick, all the things. And so please, we don't want you to be sending yourself into, like, you know, a whirlwind of breaking down and having a panic attack over anything. So please know that your well-being is important to us as well, and you do have resources through Augie as well. All right. These are all the things that are just in good old-fashioned syllabi that I don't think we all need to go through right this moment. So going over the course calendar here and walking through this, I just want to show this. This is kind of like our Bible for the course that'll tell you what we're doing each week. Every week is a module attached to it. So our first day of class is a Thursday, that's week 1, and week 2 starts the next Monday. So you have a short amount of time to do the week 1 information. But each week you have associated readings and things with that. So, you know, it talks about the topic and then what you are expected to do here. Every week you have a quiz. And then starting in week 4, you will have the case study SOAP notes that we will do as well. You also can have some other assignments that are bolded in here that could be due at that time. In week 7, I believe, yes, we have a mid-semester exam 1, and it is cumulative. These exams and the quizzes are straightforward. These are not like the pharmacology questions that could be kind of long and labor intensive to read through. These are very short and sweet. They're multiple choice, the majority of them. And these are questions like, what does it mean if you hear a split S3 heart sound? Right? These are just straightforward questions to answer, and they're really good to help you guys tie in together everything that you're learning and reinforce the important things. So I think they do well, these quizzes. I hope that we were able to really give you some good quizzes to help you study and review the material. And then at the last week of week 15, you do have a final exam and a quiz. So you'd have both. Lots of stuff going on at the end there. So this is on Canvas. This is your course calendar that will help you kind of figure out where we're at. I would point out that you can see here in weeks 1, 2, and 3, these are behind the scenes stuff. This is the history part of the history and physical. And so in week 4 is when we start the assessment part. And then each week is divided up into kind of a body system to walk it through. Let me get on the website for the ebook and I'll show you a couple things there. So this is Jones and Bartlett Learning, JBL. And this is what mine looks like as a course faculty, and I'm not sure what yours is going to look like. I saw that a while ago and I don't really remember, so don't freak out if you get on and yours does not look like this. But what happens is I think this book does a really nice job of creating this online platform for us as well. So you do have a bunch of videos over here, but when you get down, they call them interactive lectures. And so when you read chapter 1, the link, when you click on it in your module, it should take you to the interactive lecture. So it would be like chapter 1. And then what it's going to do is it integrates in there some questions of reinforcement as you're going through it. So this is one way that you can read your book. Let's see if it's going to let me work here. There we go. So the first part, lesson 1, is interview and history strategy taking. And then it kind of goes into it here, and then the introduction, and it goes down through those. So let's see, what are we doing here? Let's see, are you going to work for me? Yep, I was looking at this earlier, so let me exit this activity and see if I can get this. There we go. Okay, interactive lectures, chapter 1. That should load me into it. Oh, come on. Yep, okay. So it starts off and you can read as you go. Here it's talking about the book, the steps, the next thing, right? So you're just reading this through all the way through. And then you can select on these things to talk more about it, and then challenges, whatever. And then you get to a knowledge check. So these are just these built-in questions to help reinforce as you go, and you answer that, and then you submit and you move on. And so it's really nice this way to talk through these interactive lectures, and it goes all the way through this way, and you just move all the way through the chapter, okay? So that's really what you're going to get when you get into JBL. And then so you have these interaction lectures, and then you just have your ebook, right? So if this is like you just want to go to the book, as though it was a book that you would open up in front of you, is your ebook section here. And this one's also nice. I think it's a little more graphic oriented. I will point out that there are some ways to print off some things, to flag some things, and then you can actually listen and it'll read through for you. It's a really annoying, very computery voice, but if you want to just listen and you're an audio listener as well, those are some options for you there. So it goes through and takes you to history and taking and strategies, and you can read it through this way as the book. And then it's got some of this to go through as well. So if you don't want to do the interactive lectures, you do have options of this here. of some of these things with some of these images there, right? I think this is great. It doesn't have the interactive questions built into the ebook part, but to me, this is a lot easier on my eyes with some nice graphics and stuff, okay? And then you are going to have the ability to go to this part here. You get into the contents and you can read through specific parts to go back to refer to. They do have some enrichments built in. So this is where you'll start having the videos attached in here as well. So that works out well. And then your bookmarks can be in here as well. When you watch these videos, I like these videos. They are literally a dude in a white coat in a room telling you how to do a physical exam. It would look very similar if I were standing in front of you on campus and you were sitting there watching me do it. It's straight to the point and it's good visual as well. They use real people, so these are not animated graphics. Some of the other programs in the past where it's all animated body systems, it's just not the same. And they use real people. So when you watch the breast exam, it is a woman exposed and you can see her breast and you learn how to do a breast exam. Same thing with the genitalia exams. So they're very realistic because they are real people. I think they do a good job. They're straight and to the point. So if you go to the video, it's going to load it and we could watch the videos are expected of that you're watching them because that's how you learn how to do the technique. So I'm just going to open one up here and we can see kind of what we got here. Oops.
This is the integumentary flow. So remember that the integumentary is made up of 3 areas: the hair, including the eyebrows and eyelashes, the skin, and the nails. So again, just starting head to toe,
a good inspection
of the hair and the scalp.
So literally it's simply them showing you how to do it, and it goes all the way through for each system. So you have to read the chapter if you want to do the interactive to get those review questions, or you can just go to the ebook and then they'll show you some of the associated videos. You can also just get into right over here when you're on your dashboard here. You can also just pick the different videos that you want if you want to find that one to review again, okay? Again, they're really straightforward and I think they do a great job. So this is your book. So if I go back to Canvas and this is a student view, this should be what you see. You're going to go to your module. Oh, geez. Just joking. Hold on. You go to modules. See if it's going to work. There we go. And then you guys are going to see your week in there. So I gave these links as options. You can either just do the ebook, which is the one that I showed that had the graphics on there, or you can go to the interactive one. They're the same thing. It's just how do you want to read them? The interactive is what has the questions built in for you to review. I did attach the slides. That would be with the book. If it were me, that's just me, I would print off these slides and use them as my study guide and take notes on next to. I think they did fantastic with the slides. I just download them from JBL. And then you're going to have the quiz associated with it as well for the week. This here is just a resource. Sometimes I printed off pages of the book for you to have that are in here. So as you go through your each one, so like week 2, you have chapter 2 due to read and chapter 3. And so you can do either interactive or ebook. Those are the slides, interactive or ebook with the slides. And then that week, you're going to have 2 quizzes for each of them. Okay, and it just goes all the way through on here. And starting in week 4, you'll see that we start the SOAP notes as well. And again, I'm going to do the SOAP note and an exemplar in another video. What I want to explain then is the final kind of introduction to the course, not just going through the calendar and all of that with you guys, okay? As this says in my welcome, I'm going to talk about this a little bit. So this course emphasizes the importance of the patient interview, documentation of findings, and the physical examination in the planning and provision of holistic, culturally competent patient care. It further illustrates how you take that information and combine it with a thorough understanding of anatomy and physiology and disorders of the body systems, and you integrate that with diagnostic reasoning. You put that all together to create a complete history and physical with a plan of care. So again, we're building, building, building. So you guys built your advanced patho, then we built you on to advanced pharmacology, and now we're building you on with the advanced physical assessment. Using what you've already learned and adding it all together is what's going to prepare you to go into your next class where you're actually making clinical decisions and management, and you're coming up with plans of care, right? You're making diagnoses, you're coming up with differentials, and then you're planning what to do about them and what you're going to order and what your plan for the care is. So the three components all together are what you know of the pathophysiology, when the body, how it's supposed to work and what it looks like when it's in a disease state, how you can use pharmacology and other interventions, and then how you take their physical assessment and the history and synthesize that all together to come up with a plan of care. So really advanced health assessment, physical assessment, it also should be kind of the complete history and physical component as well. So for the first 3 weeks of the course, what we focus on is the history part, and it is just as important as learning the physical exam part. I would honestly argue it in some ways, it could be more important, truthfully. It's one of the places that we as clinicians can make the biggest errors is when we rush through the physical exam history and physical part of it. So a couple of things about the history. What we're saying is that you have to know how to interview a patient in a guided way that allows them to tell you their story. And when you do that and you learn how to do that well, they will tell you most times what is wrong with them. It is a skill and it takes practice and time to learn. And so that's why we teach it in classes, how to do the guided history, okay? You have to learn how to do that. You got to give yourself grace in that you don't know how to do that yet. Yes, as nurses, I will 1,000% believe you are really good communicators, right? That is what we're known for as nursing, is our therapeutic communication and how to talk to a patient. That's not where I suspect you to be behind the curve, so to speak. But what you haven't done before is learn how to do it through the medical lens of gaining information that you need to make a history and physical and come up with a plan of care. So there's strategies to it and real learning that goes into how to do the history. So the first 3 weeks, we talk a lot about that. One of the things I really want you guys to understand is that putting the history and physical together is really the goal of this course. So it's not just the physical exam. To make sense of why we do what we do, I want to kind of jump to the end, okay, to the end of the semester. So by the end of the semester, the goal is that you guys as students are able to do a head-to-toe physical exam and the history of a patient. So there's two components there, right? It's not just learning the technique and the physical part, it's also making sure you know how to do the history. And actually, the third part is actually learning and practicing how to document that appropriately. So by the end of the semester, you should be able to write a history and physical in H&P. You also will learn how to write SOAP notes or progress notes, okay? So that you're ready for that. So then when you go into the summer and you jump into clinicals, you know how to do those things and you know how to document them and document them appropriately. At the end of the semester, then you get a little bit of a break, and then you're going to come to campus for an immersion. And on the immersion, at the immersion, you are going to do a validation of your ability to do a complete head-to-toe physical. And so it's big, and it's a lot of pieces, like a lot of pieces. And you're going to have a volunteer, probably student, that you don't know, that you're going to walk in and you're going to do a complete head-to-toe on, witnessed by faculty, and checked off to be validated, okay? Now, it does not mean that you're going to be perfect at it, right? By any means, because you still need to learn and refresh your skills as you go into class and into the semester. So we're not asking for perfection, but what we are wanting is competency, to be validated that you can do that, and we can send you off into your next clinical knowing that you have the skills you need to do a head-to-toe assessment, okay? So as you're doing this week by week by week, know that at the end, you're going to have to come into clinical or to immersion and do a complete H&P and probably turn that in as an assignment. But you have to essentially be able to do it from memory, okay? And the reason for that, there's a method to that madness, is that it's a skill that you will need to be a provider. You have to know how to do it without a checklist next to you at all times because that's not efficient or time efficient. So knowing how to do it and doing it rote by memory is an important skill, which is why we push that you do that with very little guidance. We may prompt you if we know you're right there, but you can't think of the next thing to do. We're not mean about it, but you have to be able to do it and show us that you have the competency to do that and you understand why you're doing it and what it means. Okay. So that's kind of where we want to be at the end. And so that's why we practice the way that we do with the physical assessment. So be prepared. I'm going to attach that here, the checklist that we have, so that you have it and this is what you're all going to have to know by the end of the semester. So that's kind of the first thing to know, okay? So the physical assessment portion, we're preparing you to be able to do a head-to-toe examination of an adult patient. Then to practice the history and the note taking and how to write notes is where the SOAP/case studies come in, okay? So starting in week 4, we're going to do these. Everybody has the same case study. You're going to get the information, and then we practice on how to put that together to write it in a note and teach you the beginnings of how to think about what directed questions you ask, okay? And we'll talk more about that when I do that next video. So the history part of it is what we're going to spend the first 4 weeks on, or 3 weeks on, and then the exam part is what we're going to do at the end of this each week after week 4. The other thing that I want you guys to understand is that you get to do 120 hours in this course of physical exam practice out there and with real patients with real complaints. And that's awesome. There are quite a few programs in the country for adult acute care that do not have clinical portions with the history and physical course. You have to pass it before you're allowed to go out and examine a patient. Okay? And I want to address this a little bit and give you some time to ponder on this and think about this. This is a mixed blessing and a curse. It's a double-edged sword. So the positives of it is that as you're learning these things, you get to go out and practice on a patient. So after you read about heart sounds, then read about it and learn it, and then go out and listen and practice and have that chance to really see it in action, so to speak. So this is wonderful. You're getting that opportunity to practice your skills before you are in the next course where you have to do multiple things. But this is a chance just to practice how to interview a patient, learn how to do it, and then start to practice the skills as you're learning them on real patients. So it's wonderful in that aspect. The double-edged sword part comes in is that means, though, that inevitably you are going to be in clinical and they are going to ask you to do something or present a patient to you with a complaint that you have absolutely no idea what to do with. Right? So if week 1, you get into the situation, let's say you're in a walk-in clinic and the patient walks in and they have a sore ankle and you're like, I haven't learned that. I don't have a clue how I'm supposed to assess an ankle yet. I haven't learned it. And so if you walk in and you're ready to do it, you're going to be like looking at the ankle and like beginning to kind of look, but you're going to have to go to your preceptor and say, I haven't learned musculoskeletal yet. I'm really excited because this lady's here with an injured ankle, and I'd love to practice with you how you do that exam. So that's great, but that sometimes can be very stressful for students to be felt like they're being put on the spot when they feel inadequate, or it makes them feel like they don't know what they're doing and very overwhelmed. So you have to have that mindset when you go in, is that's okay. We talk to your preceptors, we tell them where you're at. So hopefully they understand that you are green as green. You just don't know a lot yet. You are a novice. And that the purpose is that they can see it live with something to get this time to learn it. Okay. So you have to give yourself the grace of understanding to know you are going to be in a situation where they're going to have a complaint and you're going to have to say to the preceptor, I've not done this yet. I haven't learned this yet, but I'm excited for this opportunity to see you examine this complaint or whatever it is, right? So you have to be able to say, I haven't learned that yet, okay? And that's kind of a negative in some ways because it can really stress some students out and they can really have like imposter syndrome where they're like, oh my God, I'm here and I don't know what I'm doing and people are expecting me, and get very overwhelming for your first clinical. So I just want to put that out there. into the atmosphere for you guys to hear that you have to give yourself that grace. So it's a great thing, but inevitably you are going to be in a situation where you are going to be expected to examine or whatever a situation or a condition or a body system that you just haven't learned yet, and that's okay. To really make your clinicals be effective for you, you have to advocate for practice. So depending on what the situation is, right? If you're in an ICU and you're in a crisis, you're not going to do this. But if you're in a walk-in clinic and you have a little bit of time, if the patient comes in and they have a hurt ankle and you interview them and you have to go back out and get your preceptor and come back in, maybe you say to them, I'm going to assess your ankle now. I'm a student, so I'm going to look at it and then I'll bring my preceptor back in and we'll do it together. I'm also going to listen to your heart and to your lungs. Or you can say, I know you're here with the ankle pain, but I am also a student and I'd like to be able to listen to your heart and lungs and palpate your abdomen because I'm practicing and I need the practice. Would that be okay? 98% of the time, the patients are going to say, sure, no problem. Now, again, if the patient's writhing in pain because their ankle's dislocated and they're like, what, you want to look in my ears? Are you crazy? You read the situation, but take those advantages when you can. See what kind of exam your preceptor does. Sometimes in walk-in clinics or things, they do a very focused exam. But again, read the room, and if you feel you can, practice, right? Even if they're there for toe pain, if they're pretty chill and they seem like a nice person and you're not in a dead hurry of everything, you say, would you mind if I was able to look in your ears with my otoscope? I need some practice, and then I'll go get, whatever. So you have to kind of make the clinical the best that it is for you and really get practice in what we're doing. If you just stand back and just wait for them to tell you to do something, it's not going to be as effective for you because you're not going to get a lot of practice in listening to heart and lungs and palpating livers and practicing the things that we want you to have that time to do on real patients. So that's the clinical portion of things that I just wanted to share with you, that you have to go into it giving yourself a little bit of grace. It is a skill to learn how to communicate and do a directed history with a patient. It's skills to learn how to do the physical assessment part and then how to put it all together. Okay, so we don't expect you to be perfect. This is your time to learn and to practice. What I'd like to see as the semester goes is improvement, right? So your first SOAP note that you write in week 4 to week 10, I should notice quite a bit of difference as you learn it and you get the time to practice with it. I'm not looking for perfection because you don't know it all yet, right? You're very novice in this, and that's okay. That's where we want you to be. You're in the right spot. We don't expect perfection. I just expect growth, okay? So I'm going to end here. This is your introduction video to kind of how the course flows, and I'll see you in the next video about the SOAP notes. Bye.